So Ian, we're hearing all the time about crises in social care. Is it really as bad as people are saying?
Well, it couldn't really be worse. I mean, since 2010, we've had a sustained reduction in funding for local authorities, and 80% of adult social care out of hospital is funded by local authorities. As a sector, we're forecasting the closure of probably 50 to 100,000 beds over the next 3 or 4 years. And as you know, there's only about 110,000 beds in the acute trusts. So we're facing a massive crisis.
Yeah. So this problem in social care, there seems to be a political consensus of bringing social care and healthcare together, which seems to be right across the parties. But what you're saying is, in reality, exactly the opposite is happening.
It's never happened. I mean, we've been talking about integrating health and social care. In fact, I quote, or you and I quote in the pamphlet that we wrote, a speech by Enoch Powell in 1962. Yeah. When he said we need to integrate health and social care. Everything's, a lot of things are happening out of hospital. Local authority and the health service need to be combined. 1962. Yeah. And we're still talking about it in 2016. Domiciliary care is already in crisis. 15-minute visits. Yeah. I mean, people are just not being cared for adequately at home. The big players have all left. 40% reduction in people in the number of people receiving social care at a time of the ageing population and increasing need. So it is inevitably putting pressure on A&E and the acute trusts.
Well, I think the issue in the hospitals have been increasing gradually but consistently for at least the last 10 years. And they're well rehearsed. The increased number of people appearing in A&E, accident and emergency, has gone up by about, if I remember rightly, 15% per annum. And it's a never-ending a flow of people coming through the A&E. And this isn't just one special year, it is year on year on year. So when one says there's a 10 or 15% increase, it is year on year. It's not a total, it's 10% this year, 10% next, 10% the next. And that puts immense pressure on the system. The tail end of that, of course, is the difficulty of having people move from their acute episode back into the community. The rather unfortunately named bed blockers, because of course each one of these people is one of our loved ones, whether it's your mother, your father or whatever, and yet they are not, and they don't want to be in hospital. It's the last place anybody wants to be. So we've seemed to be creating a system in which the hospital sector at least is under such pressure that it's pretty close to a position where we have ambulances waiting at A&E.
The annoying thing about this is that the care home sector is closing beds. So, the beds are available in the social care sector. Probably maybe 30% of hospital beds, acute trusts, acute beds, are occupied by frail older people whose medical condition has been stabilised. And we've got the beds. And there's a cost implication for the taxpayer. It costs about £2,000 a week in an acute trust. We could do the same, handle the same, care for the same patient for about £800 out of hospital. We have the beds. And the human cost shouldn't be ignored either. A frail older person, especially somebody living with dementia, which many of these people are, in an acute bed will lose 10% of their muscle mass a day. Yeah. So these people will die earlier. So this integration has to be solved.
Yeah. No hospital wants to keep hold of frail elderly patients. So the acute sector is keen to help the system work. The social care sector seems keen to be able to do it. Why is it that we don't seem to be able to get these two together and to get this flow of patients as everybody agrees it should be?
Because they've been separated systems since they were set up in 1948, and funding in social care has been drastically reduced, and therefore that is causing increased costs in the NHS. Stephen Dorrell talked recently about the fetish of putting money into the NHS. So you have the symptoms in the NHS, money pumped into the NHS, but you don't solve the underlying cause, which is frail older people presenting at A&E and going into hospitals inappropriately.
Yeah. So that's something which we've faced up till now, but quite clearly the situation politically has altered. We have difficulties with Brexit. How might that affect both the social care sector and the healthcare sector?
Well, Brexit's going to make things worse. I mean, the economy is going to suffer. We can all speculate by how much. Funding will go down. It is going to be difficult to raise tax revenues, especially if the forecasts for the city turn out, and tax funding from maybe as much as 10 to 20 billion pounds a year will disappear from the city. And 10 to 20% of the workforce in social care, and probably 10% in the NHS, are people from outside the UK. I mean, we've already seen in the social care sector a reduction in the number of nurses applying to work in the UK. We already have a shortage of 40,000 nurses.
And I think it's fair to say the universities have made it very, very clear it's hard to see any sunshine in the Brexit debate, because those individuals need to be able to move freely, to come and spend 3 years, say at Great Ormond Street or in Oxford or whatever, and then they need to go back to Frankfurt or wherever they've come from, and vice versa. And that more subtle effect of Brexit has equally such a detrimental effect on the delivery of high-end care in our NHS.